Dialyze Direct brings more effective and gentler dialysis to the geriatric population. In the traditional model, volume management problems lead directly to congestive heart failure, to re-hospitalizations.
And 3 times a week dialysis, you can see the vicious circle because there's not enough time to remove all that fluid. It so happens that Dialyze Direct has the answer.
Dialyze Direct has repurposed home dialysis therapies to bring them to the skilled nursing facilities.
We are able now today, with this kind of frequent dialysis, to remove enough fluid from the patients as to bring the blood pressure down to normal.
We remove a lot less fluid, but we do it much more often. Doing it much more often allows the dialysis session to be much more comfortable, much more tolerable, and gives back life and meaning to the patient.
They're able to go to lunch, go to the dining room, go to activities or therapy. They're not exhausted.
Just talking to the physical therapist, the patients are progressing leaps and bounds doing this type of therapy as opposed to the conventional therapy.
Dialysis patients represent about 1% of the Medicare population, but take up about 7% of the budget in terms of the overall care. The geriatric patients are even more expensive. The government and the other payers and everybody's moving toward an outcome-based system. From the payer's perspective, having an outcome-driven model like ours allows them to contain the costs of these sick and costly patients.
Typical dialysis patient in a nursing home would spend about 30 nights, sometimes 40 nights in the hospital, which costs about $40,000 a year. Dialyze Direct provides a solution that tackles the main reasons why they go to the hospital and improve outcomes in a population that it's very hard to track better outcomes.
The whole of what we do is much larger than the individual parts. This is an entire model of care that involves coordination of care between our entire staff, which includes registered nurses, experienced nursing caregivers, dietary support, social worker support.
We're seeing patients that don't need to go to the hospital as much, patients that are able to participate in their rehab and get better then as a result.
And if a patient doesn't meet medical necessity criteria, the patient won't be admitted to our program. We focus only on those patients that have the medical necessity and the medical need for the patient, combined with the patient's desire to be part of the program.
Lower lengths of stay, less hospitalizations, better outcomes for the patients. You couldn't ask for anything more.
Dialyze Direct has succeeded in creating a model that provides the highest caliber of care to the most difficult, most costly demographic. I believe that our company is going to experience explosive growth and that our model of care will become standard for geriatric dialysis.